Typically, for shoulder replacement or a large shoulder surgery, we often provide patients with an interscalene block, which is a type of injection of numbing medication that goes in the nerves that go to the arm. And those injections have been very helpful in reducing patients' pain and also tolerating surgery. So prior to the start of surgery is when those injections are provided, and those typically have a duration of between 12 and 18 hours. And now with some of the newer medications, they can even last longer than that. So those are very helpful to reduce pain. And it basically the whole arm is numb. You don't really have any sensation during the period of the block functioning. However, sometimes we do worry that that can cause a situation where people have rebound pain. Once that block wears off, patients are not really ready for the amount of pain that's going to come next. So typically we advise patients that the minute they start feeling the block wear off, some of the sensation to return, their hands starting to feel better, that's a good time to start the strong narcotic pain medication, especially initially after surgery. After the first few days, we try to decrease the amount of narcotic pain medication required. But during the first few days, that's usually a period where the pain can be quite severe. We also recommend icing the shoulder, which can help with the inflammation and some of the pain and help reduce some of that acute pain as well during the first couple of days after surgery. Percocet is usually the classic medication we use, so it's also known as oxycodone, and it's typically mixed with some Tylenol and the pharmacy preparation. And that's probably the most commonly used pain medication that I prescribe. Other medications are Celebrex can be used, which is more an anti-inflammatory, similar to ibuprofen or some more over-the-counter medications, or sometimes we use those as well for pain. So if a patient doesn't experience a great deal of pain, or their pain can be controlled with a less potent medication, we typically recommend that. So for instance, if a patient had a total shoulder arthroplasty and they're home and it's been 5 days and the pain that they experienced initially is gotten better and they're starting to feel a little bit better, we usually don't recommend that they continue to take the narcotics unless it's necessary. So we often advise our patients to start weaning off the medication as their pain allows. Now, obviously, if the pain is intolerable, we would prefer that a patient is comfortable after surgery, and we would recommend they continue with the pain medication until that pain can get under better control. During the first week after surgery is typically one of the most difficult times to recover from the shoulder replacement. Usually the pain is pretty significant. We do support the arm with a sling, and we ask the patients to remove the sling periodically just to stretch their elbow, wrist, and hand, and oftentimes some gentle range of motion exercises to make sure the shoulder doesn't get too stiff. Oftentimes during the first week or two, patients are too uncomfortable to sleep on their back in their bed and find that it's more comfortable to sleep in a recliner, which can help some of the discomfort as well at night. So returning to activity after shoulder replacement can be difficult. Common question is, when can patients shower? That's usually a little bit easier. It can be difficult with not very much motion of the shoulder and using the sling. So there's been different strategies and timing in terms of after surgery. Usually for the first few days, we like to keep the incision clean and dry and avoid getting it wet. So sometimes that involves something as simple as putting some saran wrap over the incision, showering, and then patting it dry. Sometimes we recommend just a sponge bath initially to allow that to heal. But usually once the incision is healed, we allow patients to shower. Driving is a little bit more difficult. I often get asked, when can patients return to driving? And my response is typically when you're no longer using a sling. So after a shoulder replacement, we typically place people in a sling between 4 and 6 weeks to allow things to heal up and recover. And so during that time, I really don't encourage my patients to drive, or would prefer they don't drive during that period of time for safety of themselves and others on the road. Dressings, usually the instructions are to remove the dressing a couple of days after surgery. Sometimes that's 2 days, sometimes that's 3 days. And then if the incision is clean and dry and it's not draining, it's patient preference. If they prefer to keep it open to air, usually that's okay. Sometimes they find that their clothing's irritating, or people get nervous about the incision, which is totally normal. and it's okay to have a dressing on to keep it protected as well. Common things we worry about after surgery, and it's normal to have swelling in the shoulder after surgery. It can be normal to have some drainage during the initial few days after surgery. And some patients get worried about infection, which is a legitimate concern. Typically, if an infection develops in the knee, in the shoulder, or any place really, it usually takes a while for that bacterial load to grow and to actually be a true infection. And that usually occurs around the 2-week post-op period. So that initial pain that people have, the swelling, the drainage that can happen, people often are concerned that it may be a sign of infection, but usually during the first week, it's too quick to develop an infection. So that's probably not what's going on. But anytime there's concerns or there's something abnormal or it's something that wasn't anticipated, it's best to contact the office to clarify. Well, I hope you appreciated this presentation. We've tried to answer some common questions that patients may have after surgery. Hopefully this will help get patients through the difficult time after surgery and recover and have a good outcome.